Hi, I'm State Senator Richard Ross, and I'm your state senator and a state senator for the district representing the Norfolk, Bristol, Middlesex district. It's 12 communities, including North Attleboro, from Attleboro all the way up to Wayland. And I'm joined today by Francisco Ureña, who is the Secretary of Veterans Affairs under Charlie Baker, who was sworn in this last February. Welcome aboard.
Thank you very much, Mr. Senator.
Glad to have you here today.
Great to be here and great to be in your communities.
Thank you very much. He's been traveling around with me a little bit today. We were in Rentham this morning at the Council on Aging. We're in here in North Attleboro this afternoon, and he's been generous enough with his time to film the show with me as well. We want to know more about you. You were sworn in January as Charlie's pick. Tell us a little bit about your military career and some of the things that you brought to the plate for him that kind of make you a good guy to be in this job.
Well, thank you very much. And so we're very pleased to be joining with Governor Baker, Lieutenant Governor Polito, and the Baker-Polito administration to represent our 364,000 veterans that call Massachusetts home. We have a network of 250 veteran service officers in these communities, and I myself served as a veteran service officer prior to being in the state. I've served in Boston for 4.5 years, and prior to that served also in Lawrence for 5 years. So I come with a background of being able to bring awareness to what our veteran service officers and what our veterans in needs are in a sense being addressed at some of those concerns.
I guess you've been in it now just a few months. It hasn't been a real long tenure yet, but what do you kind of see as your top priorities for veterans at this point?
We're really looking to ensure that our veterans that need help are receiving the services. Is not, in a sense, creating more programs, because we really feel that the programs that are available are adequate in addressing the need and is connecting our veterans. For example, veterans that are homeless. We're really focused on homelessness to ensure that we identify homeless veterans and transition them into a self-sufficiency, self-dependent lifestyle. Also want to identify our family members and veterans that are in the process of becoming, having some challenges, to ensure that they connect with their local VSOs, their veteran service officers. We want to provide, and we will provide, training to our veteran service officers and certification to ensure that they provide a level aspect of awareness of all the programs, so that a veteran in Rentham or Waltham or anywhere in between is aware of what's available to veterans and families or anybody that walks in through that office, so that they engage within the community, so that you don't have to bounce around from town to town to get a different answer, and all the answers and all the tools are available to those individuals.
That's kind of neat. I know we just came from the senior center here, where you had quite a wide array of veterans from the various groups that represent North Attleboro. You got a smattering of understanding about just how important the veterans parks and other things that are here in North Attleboro are. Mm-hmm. You also heard a little bit about the returning veterans from World War II, who actually gave up their pay and bonus pay and other stipends that they would have gotten as having served during World War II. And now the North Attleboro World War II pool is one of only 2 surviving World War II pools that were built by veterans returning after the war. Mm-hmm. What a tremendous tribute to the town of North Attleboro and to the other community that also has supported their veterans in such a way. But what a neat way for school children to learn about the wars and the people that have fought for them than to have a pool to swim in the summertime, eh?
Absolutely, especially in these weathers, right?
Getting a little warm. Yeah. Now, you know, we talked a little bit about state veterans organizations and also the benefits that come to veterans through places like Providence, Rhode Island, other things that are out of state. What is the difference between the federal programs and the state programs, and how do they dovetail?
Well, we could be here for quite some time, Senator.
Okay.
So let me
brief overview.
let me let you know that we are working very closely with all of our partners, whether federal or our local city partners and towns, to ensure that we bring the awareness. So the difference with them is that the VA owns the hospitals. Mm-hmm. They're not a state agency. They own the federal benefits and claims if something happened to a service member during the time of service, whether it's loss of hearing for many of our veterans that were involved around ammunition, a shooting range, or actual combat, may have something as little as losing hearing to post-traumatic stress to loss of limbs, and then you could create a claim to the VA for compensation. There's also other processes for dependency if you are a surviving spouse of a veteran, or if you're in assisted living or some sort of need of support. All those are federal benefits. What we have here in Massachusetts that makes us very distinct is a process of our veteran service officers mandated by law in every city and town. We're to have one, and that individual, that office, their focus is the public assistance piece, which is Chapter 115. and that is for veterans and families, surviving spouses of veterans who may be under federal poverty level or in financial distress, and that we identify them to ensure that, one, we identify homeless veterans, prevent homelessness, and provide a better quality of life to the recipients of these benefits.
Well, I certainly know one of the things that we're very concerned about, obviously, is homeless veterans as well. And certainly, I think today we had a couple of instances where we're able to say the word homeless and veteran shouldn't exist in the same sentence, but unfortunately they do. What are we doing in the Commonwealth of Massachusetts through your office that would ensure that none of our veterans have the degradation of being homeless?
So when we are identifying those veterans, we currently have a count and is 1,200, and it's 1,200 too high.
Yep.
In my book. Nonetheless, we're also accounting our service providers to ensure that they provide as much as they can for those guests within their institutions to be able to transition them as soon as possible, whenever that individual is ready. We're working with other service providers so that they can create systems of support for those veterans. For example, New England Center in Boston is creating within the structures apartments, so that no longer are they treating people as a shelter. When they're ready to transition into an apartment, small as it still gives them the tools of privacy, and then working with them to then transition so that that stop at that service is not the last stop in that person's life, that there's a future in more dependency and more resiliency among them.
Well, I know there's 1,000 units, I think, that were provided within the Boston area for veterans if they should need it. And there's 700 new federal housing vouchers that are available and 300 new or existing units of housing throughout the Department of Housing and Community Development. So I know we're all appreciative of the governor and the Commonwealth providing those kinds of opportunities. How have these initiatives helped, and what do we need to do to support you more or give you more support so that we can meet these veterans' needs?
One is awareness, and especially in the communities. You know, such venues as this cable show that you have here to really let your residents know of what is that your role as an elected official, or our role as a Department of Veteran Services is bringing awareness. Most of the veterans that come across a VSO come across by chance. And we're really providing more tools to them to ensure that they are connected in communities, that they not only are only helping veterans that are in need, but build awareness of all veterans in the community, all military families within the community, to bring awareness. And because I want you as a senator to, when you receive a phone call from a veteran in need, to make a direct referral to our VSOs. And I know how well connected you are and how well aware you are with our VSOs, and not only yourself, but ensuring your peers and other colleagues within the legislature have that level of awareness into what our role is and how important the VSO program is in our communities.
You know, we're so fortunate here in Massachusetts, being one of the older states in the nation, certainly to have been the home of the United States Army, a whole lot of things coming down the pike. But I think we do appreciate our veterans, and I know we've been very generous in the Welcome Home Bill, all of the different things that we've promoted within the legislature. We certainly also have good emissaries right in our midst. I know Senator Michael Rush serves with me. He's from Roslindale, West Roxbury area, and he has been in the Navy, and he's done so much to elevate the stature and visibility of people willing to serve. And certainly Hank Naughton is another one as well, sure, who is a representative that's still serving, who has brought great honor to his country through his service. So we're lucky to have those kind of role models that we can cite. You a couple of times mentioned today how we need to teach a new generation appreciation for what it is to be a veteran, and certainly you do a great job doing that just in your daily life. And I really, this is the first time you've gotten to know me a little bit, and I've gotten to know you, but I'm already proud to know you, by the way.
Thank you very much.
Thank you very much.
So great to
but yeah, it's a great thing, and I know that the veterans, many of them today had their hats on from whatever ship they'd served on, or whatever theater they'd served on during the Second World War, or Korea, or Vietnam. And I think that's a great thing that our veterans can do too, is help us to identify who they are when they're out in the community, so that when we're at a community event we can say, let's thank these veterans that are here with us today and thank them for their service. And I think that's one of the simplest acts that we can have to bring honor and dignity to what it was they were willing to sacrifice. I think you also noted at the last event we were at, Vietnam War veterans still suffer a stigma and an unwillingness to embrace certain veterans' benefits just because they're still not perhaps as proud of the service that they rendered to our country as they had at the time they did it. They didn't get the attention that they should have. How do we restore that? How do we show a spotlight on it and kind of draw them out of the shadows so they actually get to the benefits they deserve and they may actually need at this point?
Absolutely, and just as we were in our previous stop and engaging in North Attleboro Senior Center, letting veterans know, especially our Vietnam veterans, know that the welcome back that they receive, while it may not have been as warm as the one generation of veterans prior to them or after them have received, that we are here for them, that programs are available for them, that these programs are not handouts, but more in a sense are benefits that they earned because of their service to our country. And if they truly care about promoting and having those benefits available for generations to come, it has to be that they need to, we need to encourage them to, one, build the awareness of where they could obtain this, and they all start in that Veteran Service Office. And here within your great communities, you have a great asset across a state line in Rhode Island through a VA hospital there, and signing up for VA healthcare, especially now that we're in a time of mandated healthcare, ensuring that our veterans use that as a tool to their benefit.
What's funny is I have such a convoluted district. It literally runs one town wide from Attleboro through North Attleboro.
Sure.
Plainville, Wrentham, Norfolk. It drifts into Franklin. It picks up Millis, Sherburne, Natick, Wellesley, Needham, and Wayland. So it's a 12-town district. It's very long. And it's funny to hear people on this end talk about their relationship with the hospital in Rhode Island.
Sure.
When you get up to the northern end, they're talking about Bedford or they're talking about Boston, and it's tough sometimes to keep sorted out the regions. But we're very lucky that we have an assortment of veterans hospitals available to our veterans here in New England and particularly Massachusetts. So we're very fortunate, aren't we?
This is true, and for the size of our Commonwealth, take a look at any other state that makes up what we have, and we're very fortunate. And in order to keep that fortune that we have with these three main veteran service, veteran hospitals, is continuation of usage of these hospitals, ensuring that our veterans are signing up for these benefits and these medical systems that they have. And again, they don't have to drop what they have. Take a look. If you had a bad experience in the past, just as a veteran shared today, take another visit, take another chance with the VA and see, and you more than likely will be surprised at how the VA has developed and has evolved from a service of the past to really a community-based service.
Yeah. You've also made just an important point a moment ago as we started to talk about this. They have to sign up because if they don't, one of the questions is how many people are utilizing veteran services? And if people don't sign up and make themselves known, then the answer becomes none. If the answer is none, then how do you get funding for the future? They'll say the need's not there. So it's not like we're creating a need out of something that doesn't exist. We're just asking people to put themselves on the radar screen and being willing to say that they're a veteran and that we need these things to be funded, because there are a lot of people out there that do need those services. There's no doubt about it. And we are facing so many troubling things that we didn't expect. The mental trauma that comes back with a veteran when he comes back from the theater of operation and maybe becomes a drug dependency or an alcohol addiction or something like that is certainly something that's unprecedented in previous wars to such a degree, and we can now document it. The opioid addiction crisis that we're going through now is particularly troubling, and whether it is veterans that are coming back or even professionals that are older, that are out of a job, who try something for the first time, and before you know it, they're addicted, or people on painkillers. We have a tremendous problem here with a tremendous cost. So I think we're all struggling with trying to find ways to get people off that dependency and back into productive society again. Do you think we're doing enough, or do you think there's areas that, particularly through your secretariat, you might be able to help us with as legislators by making us aware of programs that certainly need to be better funded or better tailor-made to meet the needs of the veterans that are returning?
We're constantly having that conversation, Senator, and education as well as, and it's great that we have this relationship where we can have this forum of ensuring that we engage and that you have the willingness to learn about what differences you can make, and so that's very commendable on your part. The aspect of